Welcome back to the channel. Today we are talking about the hypertrophic cardiomyopathy, one of the common inherited disorder. It is important to us because it can affect the young people and leading cause of sudden cardiac death in the young and athletes. Let us break it down simply: what it is, why it happens, how we diagnose, and most importantly, how we treat it. Hypertrophic cardiomyopathy is a condition where the heart muscle, especially the left ventricle, becomes abnormally thick without another cause like high blood pressure or valvular disease. This thickened heart muscle makes it harder for the heart to pump blood effectively. Regarding prevalence, about 1 in 500 people is quite common. It can be with or without cardiac outflow obstruction, thus the term obstructive variety or non-obstructive variety. In this diagram, we see the heart on the left side, it is normal heart. On the right side, we see the hypertrophic cardiomyopathy heart, where the left ventricular wall and interventricular septum is thickened, and due to thickening of the interventricular septum, there is narrowing of the left ventricular outflow tract. The horizontal red arrow showing this, the left ventricular outflow tract obstruction. Now, the causes and pathology. In most cases, hypertrophic cardiomyopathy is genetic. Mutation in genes like MYH7, MYBPC3 affect the sarcomere, the contractile unit of the heart muscle. The muscle fibers look disorganized, disarrayed, unlike normal parallel fibers. This disarray plus fibrosis makes the heart scary, steep, and irritable, predisposing to arrhythmia. The common site of thickening are left ventricular wall, the interventricular septum, which can bulge into the outflow tract and can cause blockage of the blood outflow. There may be systolic anterior motion of the mitral valve. Now, the discussion about the clinical features. Many patients have no symptom and are diagnosed during a routine checkup. When symptom arises, there may be shortness of breath, chest pain, palpitation, dizziness, or fainting, especially on exertion. The most feared complication is sudden cardiac death, often due to dangerous arrhythmia. That's why the disease gets so much attention in young athletes. Regarding diagnosis usually starts with physical examination, sometimes a murmur that increases when standing up or during Valsalva maneuver. Echocardiography is the gold standard, showing asymmetric septal hypertrophy, often with obstruction, LV wall thickening, systolic anterior motion of the mitral valve. ECG, cardiac MRI, and genetic testing also help. Here, the fourth chamber cardiac, in the echocardiography, we see the echogenic interventricular septum, which is thickened, out of proportion, thickened, and there is LV wall thickening. We see here the thickening of the interventricular septum and LV wall is very much prominent in this echocardiography picture. Treatment approach: two main goals: control symptom, prevent sudden cardiac death. Medication: beta blocker and calcium channel blocker like verapamil to slow the heart rate and improve ventricular filling. Disopyramide may also be used. New drug: myosin inhibitors like mavacamten are now approved. Procedures: septal myectomy, that is surgery to remove part of the thick muscle. Alcohol septal ablation, controlled destruction of muscle with alcohol injection. Implantable cardiac defibrillator for those at high risk for sudden cardiac death. To summarize, hypertrophic cardiomyopathy is a genetic and serious clinical condition, but with proper diagnosis and treatment, many patients live long. Thank you.